My name is Tara McGee, and I'm going to do my presentation on Maslow's hierarchy of needs. I'm going to apply it to nursing or use it as an example to apply it to nursing and to patient care and critical care. Today I have my husband Nathan McGee, who I'm going to be presenting to, who is actually filming me right now. So the first part I'm going to do is I'm going to introduce the 5 points of Maslow's hierarchy of needs, and the last 2 points are going to be applied to nursing and in critical care. So I wanted to show you the first one is going to be psychological needs. We're going to go over safety needs. We're going to go over love and belonging needs, esteem needs, and self-actualization needs as well. And then I'm going to apply it to nursing and patient care and critical care. So before I go into detail with the Maslow's hierarchy of needs, I wanted to show you the pyramid of Maslow's hierarchy of needs. So on the pyramid, it starts from the very bottom here, which is going to be the psychological needs, which is the basic needs. The second step is going to be the safety needs. This is going to be the next need that you are going to fulfill after you have met the psychological needs. The third one is going to be love and belonging. This is going to be the third step in Maslow's hierarchy of needs. And once you have met the first 2 needs of the psychological and safety needs, you can move on to the love and belonging needs. The next one is going to be esteem. Once you have met the first 3, you can use the esteem, which is going to be more of a confidence and strength. The last one is going to be self-actualization. This is where you can use your realization of your self-potential. So now I'm going to go into starting on each point of Maslow's hierarchy of needs. The first one I'm going to start with is the psychological needs. Psychological needs is a basic survival needs. This is what you need to survive. You need these things like air, sleep, warmth. You need clothing, food, and shelter. All these things you have to survive. If these needs aren't met, you cannot survive. So the next one is going to be safety needs. So once you have met the first stage of Maslow's needs, which is the basic survival needs of food, water, and shelter, and sleep, you can move on to the safety needs. Safety needs are in place for safety reasons, okay? So you can use this like laws. For example, laws are a safety need. We have laws in place so it keeps everybody in safe. Follow the speed limit. Follow the rules and laws that you have at your work and employment area. The next one's going to be health. This also falls under a safety need. You need to take care of yourself. You need to make sure you have resources that you need to be able to take care of yourself and your family and others. So you also have personal security. Personal security needs, you need to take care of your own self. You need to feel like you are taking care of yourself. That kind of goes along with health needs. So the next step we're going to go over is going to be love and belonging. This is going to be the third step of Maslow's hierarchy of needs. Once the first 3 are met, like I mentioned before, the psychological and the safety needs, you can move on to the love and belonging. Love and belonging means in Maslow's hierarchy of needs is that you also need to have friendship, family, and a sense of connection. Whether that be a sense of connection to the world, to your friends, your family, your school, your workplace, like social media. You need to feel like you have a place that you belong. So love and belonging is very important to have in your life. You got to have support. You got to have love. You got to have people to be there to support you when you're in need. So the next step is going to be esteem. So once you have met the needs of psychological needs, safety needs, love and belonging needs, the next step is going to be esteem. So esteem, what it is, you got to build your confidence. You got to have confidence in what you do. You got to have strength in what you do. You got to have recognition. You've got to have the ability to be able to say that I can do this. You can use recognition and strength and status and respect. You gotta have respect for yourself and respect for others, whether that be your family, co-workers, and your friends. Once you have met that need, you can move on to the last one. The last one is going to be self-actualization. This is going to be a self-fulfillment. Once you have met all the previous needs, you can use self-fulfillment as a potential that you can use to apply to your dreams, knowing that you have a lot more potential for yourself that you can apply it to your dreams or to whatever your desires, personal growth, to like nursing. If you want to go to nursing, you can use all those things to apply it to what you want to do in life. Realizing or seeking personal growth. If you want to add more, realizing that you want to grow more, that is a stage for self-actualization. Now that I've gone over the 5 points of Maslow's hierarchy of needs, I'm going to use these and apply these to nursing. Nursing is a career where Maslow's hierarchy of needs are definitely used. So I've got a graph here that Maslow's hierarchy of needs are used as into nursing. So the psychological needs for nursing, like the bottom portion, will be important for nurses to be able to have rest and to have nutrition, to be able to eat and sleep. Nurses typically work 12-hour shifts, maybe 7 days in a row, maybe less than that. It just depends on the hospital's needs. You want to have nurses to be able to work and be able to sleep and eat and to function properly. Once you can do that, then the next step is safety needs. Once the nurses feel like they have a break, or they have been, they can eat and they have enough sleep, that will reduce the amount of safety needs. Safety needs comes next in the pyramid. So safety needs and healthcare for nursing is very important. It's important for patient care. You want to reduce the amount of medication errors of notes, errors of different things. And that also goes along with the psychological needs, making sure the nurses have enough energy and nutrition to help them function properly for the safety needs, to make sure that we reduce those errors. The next step is going to be a need for belonging. You want to have work with a team of nurses and doctors and co-workers to have work together to work together to be able to achieve excellent patient care. It's all about taking care of the patient. We need to communicate. We need to work together and know each other and not be against each other, but be with each other to support each other. And with one that needs help or one that is struggling, you can use love and belonging to be there for each other. And when one's down, you can be there. So the next step is going to be need for self-actualization. With the hierarchy of needs for nursing, this one goes into having decision making, having the ability to be able to make executive decisions in a critical point, especially in nursing. That's going to be, you want to feel, after you have met all of these, the esteem and self-actualization falls in one category for nursing. So when you have the esteem and self-actualization, you got to have the confidence to be able to make executive decisions in patient care. You may be in a critical spot where there's not someone around and someone is really needing some help. You need to be able to make that executive decision to help save that person's life. So the last step I'm going to apply is going to be patient care and using Maslow's hierarchy of needs and patient care and critical care. So I've got a pyramid here that I go over within critical care. So with Maslow's hierarchy of needs and critical care, the first step is going to be the psychological needs, of course, that I mentioned before. This is also going to be used as failure for support for failing organs. You want to make sure you take care of that first. Pain management. You also want to take care of nutrition. You need to make sure that those are taken care first before you move to the next step. The next step is medication errors as well for safety. Again, this is most critical point in healthcare is medical errors. You want to reduce as many medical errors as you can. It's because of patient safety and safety for yourself. The next one's going to be love and belonging. Love and belonging in critical care is very important. You want the patient that is in the ICU to feel like they're still loved and open up, friends and family and visitation rights for them to be able to feel like they're being supported in a time of need. There are also maybe some support groups for them as well, that if maybe they don't have family, but they have a group of people that may be in the same situation as they are. So the next one is esteem. You want to give your patients enough respect. You want to give respect for your doctors, your nurses, and patients. So in critical care, you want to work together as a team and communicate effectively to be able to attend to the patient in their needs. So with esteem, you can't have low confidence, you can't have low strength. You really need to be confident in what you're doing, because if you're not confident, patient's not going to feel confident. The next step is going to be self-actualization. With this one, you want to help the patient realize, okay, so now I've got new limitations and I need to understand and realize, okay, what can I do with what I've got? I can learn to do better, or learn to walk better, learn to do, have a new identity, to understand, okay, now that I'm in this new way, that you can use that as a potential that they can, if they have dreams, like if they want to walk or run, and because they have like a leg impairment or something, they need to realize that because they can do that, they can apply themselves to that. So with applying Maslow's hierarchy of needs is extremely important in the medical field, whether that be nursing or in critical care. So today is my presentation on Maslow's hierarchy of needs. These are my references. Thank you.